A sustainable health system for me has should constitute these factors. These factors have to be present in a sustainable health system. First, there should be institutional accountability, especially for our Department of Health. They should be able to account for every peso, for every program that they implement. Another one is a strategic perspective and plan. Because it can't just be in a whim or dependent on the leader. They have to have like a blueprint for the health system, and promote primary health, health seeking, and health values, and very important, good leadership.
I want patient engagement to create unsustainable health systems that focus on what people with lived experience or patients actually need and want, which is often coordination, prevention, true integration. And that means those three vested interests having to let go. And that means concentrating on social inequalities, on diversity and inclusion, and what matters to poorer communities much more than they do so.
So as a health systems researcher and economist, we typically think of sustainable health systems as systems that are efficient in many ways, that they use resources in a way that is technically efficient, that is allocatively efficient. So we put the resources to their best use across the health system. And at the end of the day are also equitable. But I think if we take a bigger perspective to sustainability, we're seeing a couple of new dimensions come up, especially in recent years, that we haven't thought about as deeply, but we now know are just as important. Health systems have to be sustainable from the point of view of the broader environment. So we have to think about, what we think of as ESG goals in relation to health systems. They have to be culturally sustainable. So they have to be built in a way that at the end of the day, for a specific country in a specific setting, makes sense in the long term. And at the end of the day, they also have to be politically and ethically sustainable.
As a physician, I've always thought that patients do play a critical role in the therapeutic alliance, working together with their providers on what's best for them in terms of their care, the management and treatment of their disease conditions. I think we need to expand this concept of therapeutic alliance and turn it into a health system alliance between policymakers, providers, decision makers, and most especially the patients. And in the context of a sustainable health system, if we want a health system to sustain the provision of high quality care to all kinds of patients, we need to make sure that patients are able to co-create solutions and policies and protocols, that there is a system put in place to garner their feedback on a timely and meaningful manner, not in a token fashion. And that patients are also included in various steps of policy creation and decision making.
Patients are often actually experts in their own conditions because of accessibility of information or investment of the entire, the time and energy into learning more about their conditions and the access to support groups. Patients have a very high degree of knowledge and information and expertise around their own conditions. So in order to really effect change for people living with rare diseases, it's critical to engage them because they know more about their conditions than anyone else does.
So to have a sustainable healthcare system, as I mentioned, you need therefore to understand what really matters to the patient. Patient engagement can be seen, I see it in two different trusts. The first trust is patient engagement during that interaction between the patient and the clinician, the nurse or the doctor in the clinic, and they are being engaged on their care. There's a shared decision making, there is proper informed consent, and the doctor and the nurse knows what matters to the patient for the particular treatment. So that is patient engagement at the very, what I call that, the more localized level. Okay. Then you have patient engagement on a more systematic organizational level, whenever you are working on a project to improve healthcare, be it patient experience, quality, patient safety.
So, you know that health systems are built to care for patients. So it is important and vital that we understand patients' needs and expectations. And this is one of the reasons why we do an annual Cigna 360 well-being survey. So this survey gives us a chance to see how people around the world are feeling about their whole health. What does whole health mean? It means not just physical or mental, but also social, work, financial, and family health.
In fact, as a human rights lawyer, I will use the definition of the right to health. And we usually use the acronym of AAQ. AAQ is availability, accessibility, acceptability, and quality. And patient engagement, and again, I will really go beyond the patient and really population engagement and person-centered approaches. So having a patient representative in each one of the decision-making bodies is essential for also the quality of care. There is a vast literature around having a patient at the table is making a difference not only for the patient herself, but also for the providers in a full system. So it's really a virtuous cycle, and it's really at the core of the human rights to health.
Patient groups have a key role in helping the institution become accountable and responsive to the patient needs. Here in PAPO, we continuously give feedback and at times pushback in expanding the frontiers of the health system. So we collaborate.
As you've heard from some of our CAPE community members, patient engagement and sustainable health systems are inextricably linked. We at CAPE believe that patients should be partners for sustainable health systems, and this is the theme of our ongoing work for the coming year. We invite all stakeholders from any part of the health system in any country to join us if they share our passion for patient engagement and involvement. CAPE is the coalition to accelerate patient engagement in Asia Pacific. It is a multi-stakeholder partnership hosted at Duke-NUS Medical School by the Center of Regulatory Excellence, the Singhealth Duke-NUS Global Health Institutes, as well as our partners. We work in three main ways at CAPE. First, we raise awareness on global and regional best practices and case studies. We are also undergoing a landscape mapping to map the patient ecosystem in the region. A second part of our work is to provide a neutral academic platform to convene and connect all stakeholders from across the health system. Our third area of work is to build capacity for all stakeholders by providing training, resources, and tools to effectively engage patients during health products development, regulation, and health technology assessment. We also work to build the important soft skills for patient engagement, such as multi-stakeholder communications and the art of making the case to decision makers. We hope to see you at the Roundtable and hope to see you at the conference in 2022. Patients are partners for sustainable health systems. Thank you.